Welcome to Alberta Impact, Future of Health series. I'm your host, Bryce Lambert. This series came to be in partnership with Health City. Who are they and what are their initiatives? Those are some of the questions that are probably on your mind. So let's find out. Please welcome Reg Joseph, Antonio Bruni, and Chris Carvalho. Gentlemen, thank you for joining us.
Thank you.
Thanks for having us,
You
Bryce.
betcha, absolutely. So let's start off. So what exactly is Health City and how did this kind of come to fruition?
Sure. So Bryce, Health City is a nationally incorporated nonprofit, and really our role is to transform the health economy. And we're looking to drive better health outcomes as well as improve our economic development in the region. And that can be scaled globally.
Gotcha, right on. And you guys talk a lot about bridging those gaps in health and whatnot, and that's a really cool initiative. I've been reading a lot about this, and it's really cool to have this partnership with you guys. So thank you so much for that, first off. So can you tell us a little bit about who's all involved?
Sure. I mean, this is a partnership with a lot of organizations, Bryce. We've got over 100 organizations and companies tied in with Health City, of which 65 of those are companies. And these companies are new and exciting companies that are driving health innovation in our province today.
Yeah, that's super cool. And can you tell us about some of the initiatives that are coming out of this entire process?
Yeah, so effectively the way Health City operates as a neutral broker in the community of driving innovation with these with the overall goal of improved health outcomes is really bringing together disparate groups of multi-stakeholder partnerships. So we'll bring in or aim to bring in multinationals who have incentives who want to drive health improvements and outcomes. We really want to work with local companies, as Reg alluded to really create and co-create a lot of those tools to drive the innovation in the community. And then we also have partnerships with post-secondary institutions, clinicians, and so on. So we really try to bring groups that may not conventionally come together and really create collaboration in that context.
Yeah, and collaboration is so important right now, especially with growing this entire ecosystem and pushing into the future of health and what the future of health is going to look like. So, and how about how's the data kind of work in this kind of scenario? What does that look like?
Yeah, so we've got a couple initiatives that touch upon the points that Antonio just mentioned about bringing different groups together. Data and access to data is obviously a big challenge, or in many cases difficult for companies, especially to get access to. Mm-hmm. So one of the initiatives we're working on that I'm really excited about is our synthetic data initiative. So how do we actually create patient data that's representative of the Alberta population or a subset of that, and open it up to SMEs, MNEs, and give them access in a way that is compliant from a privacy and security perspective. If we can do something like that, then I think we have the ability to actually increase the access to market and really help companies actually grow and scale.
That's very cool. And you guys must see so many things now. I mean, with being involved with that many companies and that many organizations, and we know there is a ton of innovators out there that are coming up with new technology, new initiatives, new platforms and programs almost daily. Can you tell us a little bit of some of the cool stuff that you guys have seen, or some of the things that you guys are really excited about that you see coming forward and making an impact?
Sure, absolutely. Behind what I'm calling the new health economy, there is three major technology platforms that are driving big change in health right now. That's artificial intelligence, machine learning, augmented and virtual reality, and the Internet of Things, IoT, and blockchain. Yes. And all of these technology platforms are transforming health as we speak. Many of the companies that we're dealing with have one of these technology platforms as their background.
Gotcha. And what are some of the are there any really cool stuff that you can kind of pinpoint out, or do you want to talk to some of those things that you think are that's something that we really want to put out into the public knowledge?
Sure. Most recently, there was an announcement about this new initiative, a new nonprofit that Health City actually had a strong role in helping to foster, called Elixir, Enhanced Learning Incorporating Extended Reality. And extended reality is the combination of augmented and virtual reality. And to Reg's point, our community does have a lot of the strengths locally, either from the private sector or from the post-secondaries. And essentially what this is doing is creating a platform for the post-secondaries to either contribute content or invite private sector to contribute content to really distribute in this marketplace effectively. So we're creating an environment where tools can be generated for post-secondaries to utilize in part of their content delivery for students, but also provide an opportunity for those that have the capacity within the post-secondaries to create the content. So it's creating a funnel system to that regard.
Gotcha. And are you seeing a lot of like these, I can imagine you're seeing a lot of these partnerships forming by you guys in existence of connecting these people by being that web. Can you speak to some of those, like some of those partnerships that are seeing? How's the response been to the entire program of Health City?
Yeah, interestingly enough, it's not as hard as we thought it would be.
Yeah.
A lot of these folks are looking for opportunities to partner, but honestly, the way our system's been set up, it's been quite siloed. And so a lot of times people are just not aware. And so what Health City's been doing is sort of hosting this table and being able to bring disparate partners around the table, looking at common goals that we're trying to achieve. And honestly, the people are coming in and they're saying, we didn't realize that we had an opportunity to collaborate with maybe a primary care network or a company or with the health system to do something like this.
Right.
And as we host the table and look at those solutions, people are coming together and solving that.
Right on. Well, it's so nice to see that you guys are looking to deconstruct those silos and build those relationships and open those doors. And I know that it's reaching out across. I mean, you're Alberta, Canada, and you're getting out into the world, and a lot of people are starting to take notice. And that's fantastic to see. And bringing those people here that see opportunities here and see how our health is in our health economy. That's here in Alberta. And so we're super excited to have you guys involved in this and making this happen. So thank you so much for the information. Thanks for joining me today, and we look to help you guys spread the message far and wide and like wildfire. So
Wonderful, thank you.
Thanks,
Right on. Thanks for joining
thank
us today, guys.
Yeah, thanks.
There you go. Thank you so much for coming in and watching the show. You can find out more about Health City and connect with them through the links below.
What that's called.